Just a nurse. That was what Dr. Marcus Sterling saw when he glanced at Katie Morrison moving through the pre-dawn corridors of Sacred Heart Hospital in Norfolk. Just another competent civilian with a stethoscope and scrubs. He had no idea that beneath those cotton layers lived a senior chief petty officer who had dragged wounded men through Sangin's killing fields. He didn't know that her trembling hands during code calls weren't nerves, they were muscle memory fighting to stay buried. Katie arrived at 5:36 a.m., the same time every shift, moving through the fluorescent-lit hallways with the kind of practiced invisibility that comes from wanting to disappear into walls. Sacred Heart's ICU sprawled across the third floor like a mechanical garden of monitors and ventilators, each beeping in its own arrhythmic rhythm. She clocked in at the station, her ID badge already worn smooth from 3 years of this, 3 years of healing people while her own wound stayed stitched shut inside places nobody thought to look. Her assignment was the same as always, beds 312 through 318, a rotation through the trauma ward's chronic cases. She moved down the corridor checking vitals on patients who existed in the strange purgatory between life and deep unconsciousness, her hands moving with the steady precision of someone who had performed these same motions 1,000 times before. Cold stainless steel bed rails. Warm skin over fragile veins. The hiss of the ventilator in room 315. All of it familiar enough to navigate on autopilot, which meant her mind could stay somewhere else, somewhere she didn't want it to be. Room 312 stopped her cold. The patient chart read John Riker, 34, Navy SEAL, admitted 6 weeks prior with traumatic brain injury secondary to IED blast, Helm and Province, 2019. The name meant nothing to her from a clinical standpoint. The photograph attached to his chart showed a man with eyes that had seen too much, a hard jaw, the kind of bone structure that came from bloodline and discipline. But when Katie stepped into the room and saw the tattoo on his left forearm, black ink faded to the color of old bruises, her entire nervous system went still. Reaper. Her call sign. His skin. It took her 17 seconds to remember how to breathe normally. She counted them off like a meditation, the way they'd taught her in the VA waiting room after she'd walked away from active duty. Breathing was data. Breathing was control. The antiseptic smell of the room, bleach and alcohol wipes and the underlying metallic stench of long-term illness, triggered a flash that she didn't have time to process, desert heat on her face, sand in her boots, the weight of another man's unconscious body across her shoulders as she ran toward the thud-thud-thud of rotor blades. She touched the faded unit patch sewn inside her jacket lining. A ritual she performed at the start of every shift now, proof that she had been someone once, that the memories were real and not just echoes in an empty apartment at 2 a.m. Riker's eyes were open but empty. 1,000-yard stare. No cognition in the pupils, no tracking, no response to external stimuli. His hands lay motionless across the blanket, strong hands, the hands of someone who had learned to use force with purpose and precision. A breathing tube ran down his throat. Monitors tracked his heart rate at a steady 68 BPM, his O2 sat holding at 96% on room air alone. Stable. Vegetative. The kind of patient hospitals kept in long-term care not because there was hope but because stopping felt like giving up. Katie checked the 4 lines with mechanical precision, her movements practiced enough that she could do this work while her mind was somewhere else entirely. But her mind wasn't somewhere else. It was here. It was 5 years ago. It was a place called Sangin, Helmand Province, where she had carried this man, unconscious, bleeding from his left temporal lobe, across 200 meters of open ground while rounds snapped past her head like angry hornets. She had loaded him into the medevac helicopter herself, pressed her hand to his chest as the rotors kicked dust into her eyes, and watched the aircraft rise into a sky that was the color of rust and failure. She had never expected to see him again. The intercom crackled overhead. Code Blue, Trauma Bay 2. Code Blue, Trauma Bay 2. Katie's hand moved to the call button before her conscious mind caught up with the instruction. 3 years of civilian nursing had taught her to respond to codes like a trained animal, not thinking, just moving. She was already pulling her hands from Riker's room when the first responders rushed past her in the hallway, their faces set in that particular mask of controlled panic that came from watching someone's heart decide to stop working. The trauma bay was chaos-coded, a middle-aged man, bloated from 3 weeks of post-op complications, his chest heaving against the defibrillator pads. The resident, fresh-faced, probably 6 months out of med school, was frozen at the foot of the bed, one hand holding the crash cart while his eyes tracked the monitor as if the answer might appear there if he stared hard enough. His name was Chen. Katie had seen him around Sacred Heart, knew he was smart enough but green enough to hesitate when decisions needed to happen in the space between heartbeats. Dr. Marcus Sterling arrived exactly 4 seconds after the crash was called. He was always precise about his timing. Katie had noticed this about him over 3 years of shifts. He moved through the ICU with the gait of a man who had never had to run toward anything in his life. His shoes, Italian, probably $400, clicked against the tile with rhythmic certainty. He wore his status the way other men wore cologne, expensive, noticeable, meant to announce that he had paid for expertise and that this expertise was not in question. Epinephrine, 1 milligram 4, Sterling said, his voice carrying the tone of a man reading from a script he'd already memorized. His eye swept the monitors without really looking at the patient. Defibrillate at 360. The code proceeded the way most codes did in teaching hospitals, methodical, textbook, absent of actual desperation. Katie stood back at the periphery, as was expected of nursing staff during physician-directed resuscitations, and watched Sterling work. His hands were steady enough. His knowledge base was clearly functional. His problem was that he approached the crash like a mechanic with a car, not a healer with a human being. There was no sense in him that he was standing at the border between 2 different kinds of forever. 30 seconds into compressions, Katie's hands began to tremble. It wasn't fear. It wasn't nerves. It was the specific tremor that came from every instinct her body had developed over 12 years of military service screaming at her to step forward, take over, use the knowledge that had kept 83 personnel alive through direct action raids where staying still meant staying dead. But she was a civilian now. She had left all of that behind. She had chosen anonymity over authority, and the choice had felt like wisdom at the time. Now it just felt like a small death happening in real time. Sinus rhythm, the monitor tech announced at 90 seconds. His back. Sterling allowed himself a brief nod, the smallest acknowledgement of capability. He stripped off his gloves with the precision of a man who had performed this action thousands of times, snap, snap, and dropped them into the biohazard bin. He glanced up from the patient's now heaving chest and his eyes found Katie standing at the edge of the room, her hand still trembling, her face carefully neutral. He smiled. It wasn't a warm smile. It was the smile of a man who saw something he could use, something pliable, something small. Katie had seen that smile before, on the faces of senior officers who could identify weakness in the way a person breathed. Sterling's eyes lingered on her hands for exactly 2 seconds too long, committing the tremor to memory, cataloging it as data. Then he turned away and began giving orders for post-resuscitation care with the casual authority of someone who had never been told no. Katie walked back to the ICU alone, the fluorescent lights humming their relentless white noise meditation above her head. Her hands had stopped shaking by the time she reached Riker's room. She had learned to control the involuntary responses years ago, breathing through the panic, grounding herself with cold water on the wrists, pressing her feet into the ground until the trembling became just another piece of information her body was processing. Riker hadn't moved. The monitors still tracked his heartbeat, steady and purposeless, a body that had decided to continue existing even when the person inside had checked out completely. Katie pulled the chart from the foot of his bed and read what the physicians had already concluded: severe traumatic brain injury with diffuse axonal damage, minimal chance of meaningful recovery, current status is chronic vegetative state with minimal indicators of consciousness. What the chart didn't say was that she had brought this man to this hospital 5 years ago. What it didn't say was that she had screamed his name into the medevac pilot's ear while blood ran down her own shoulder from a ricochet that could have ended her. What it didn't say was that she had memorized his call sign well enough to tattoo it on her own heart, the way certain soldiers do when they've shared the specific kind of intimacy that comes from keeping each other alive. But none of that mattered now. None of that was relevant to his care. All that mattered was the next dose of antibiotics, the way his lungs expanded and contracted with the ventilator's mechanical breathing, the vitals that remained stable because his body was too stubborn to surrender. Katie sat down in the vinyl chair beside his bed and opened her laptop to the electronic health record system. She had 23 more patients to check before Sterling's rounds at 7 a.m. She had medications to verify, orders to process, the invisible work that kept a hospital functioning. She told herself she would not look at Riker's forearm again. She told herself that recognition was a luxury she could not afford. She told herself that the woman who carried him through Sangin had died the moment Katie Morrison became a civilian. But when she glanced at his face, still, empty, broken in ways that no CT scan could fully capture, she knew that she was lying. And that was when her phone buzzed in her pocket. A text from an unknown number, Sacred Heart ICU. Seal patient in bed 312. Need medical assessment. No names. No records. For hours. The room went dead silent. Even the ventilator seemed to pause, as if the universe itself was holding its breath. Katie stared at the message for exactly 3 seconds. Then she deleted it. Some wars followed you even when you walked away. The monitor screamed at 0300 hours. Riker's body convulsed against the hospital bed restraints, his 4 lines tearing free as his hands clawed at nothing, at everything, at the ghosts only he could see. His eyes were wide and unseeing, locked on a dusty street in Sangin that existed nowhere but inside his shattered mind. Sweat soaked through the cotton gown. His breathing came in ragged gasps that sounded like a man drowning on dry land. Katie heard the alarm from 3 rooms down. She was already moving before the call bell chimed a second time, her feet carrying her through the darkened corridor with the precise speed of someone who had moved through worse darkness. The night shift was skeleton crew, only 2 nurses on the unit, and the other one was locked in with a post-op patient who needed continuous monitoring. Katie reached Riker's room alone. His mother, Eleanor, stood at the bedside in a flannel robe, her face crumpled with helplessness. He won't wake up. He's having another one. Please, can't you give him something to help him sleep? Katie approached slowly, deliberately, her hands visible and open. Not reaching for sedatives. Not reaching for the phone to call Sterling. Reaching for the simple gravity of presence. She pulled a chair close to Riker's shoulder, angling herself so he could see her face when his eyes found focus. His thrashing continued, the restraints creaking, his vocal cords producing sounds that belonged to a battlefield, not a hospital room. Riker, Katie said. Her voice dropped to the register she had learned in a field hospital outside Helmand Province, low enough to penetrate panic, steady enough to anchor someone drowning. Riker. Look at me. His eyes swept past her twice before they caught. The moment he recognized a face that wasn't threatening, his breathing hitched. Not better. But different. The thrashing softened by a single degree. You're in Norfolk, Katie said. Norfolk, Virginia. Sacred Heart Hospital. It's 0300 hours. You're safe. He's in pain, Eleanor whispered. Can't you sedate him? Not pain, Katie replied, never breaking eye contact with Riker. Memory. She reached for the call button and turned off the overhead alarm. The sudden silence was almost violent. Count with me, Riker. Count the blue chairs in this room. I'll start. 1, 2, 3. Where are we? North. His voice cracked like old leather. Norfolk. Keep counting. You're doing the work. Your brain is waking up from a dream. Give it something to do besides fight. Eleanor sat back down, her hands trembling. Katie continued speaking in that low, measured cadence, the one that had talked bleeding men away from panic, the one that had negotiated with gunshot wounds as if they were reasonable things. She didn't mention sleep. She didn't mention medication. She mentioned breathing. She mentioned the pulse in his wrist. Feel that? That's you. That's your heart working. That's you winning, and she mentioned the rain she could hear against the window, the distant sound of the city moving into morning, the proof of a world that existed beyond the war. 17 minutes. That's how long it took for Riker's breathing to sync with hers, for his hands to stop clawing, for the terror to drain from his eyes and leave something almost like exhaustion in its place. The restraints went slack. The door exploded inward. Dr. Sterling filled the doorway with the kind of presence that made the fluorescent light seem to dim. His white coat was perfectly pressed even at this hour. His face was the color of a man whose authority had just been questioned by someone with no right to question anything. Behind him, 2 residents hovered like shadows. "I ordered chemical restraint for PTSD episodes," Sterling said. His voice had the texture of gravel being poured down a drain. Not theatrical lullabies. Katie rose slowly, keeping her movement steady, her hands away from any medication cart. When she spoke, her voice remained at the same measured register. "Chemical restraint causes acute confusion in TBI patients. The agitation you're seeing is flashback response, not medical emergency. His vitals are stable. His SATs are 98%. Grounding techniques interrupt the trauma loop without creating secondary." Grounding techniques. Sterling repeated the words like they tasted like poison. He stepped into the room, and Eleanor instinctively moved to give him space. "Nurse Morrison, did you attend medical school in the last 6 months? Because I'm fairly certain you're an RN with a 2-year degree." He turned to the residents. "Make note of this. When nursing staff begin prescribing psychiatric interventions, we have a serious protocol violation." Riker's mother made a small sound, something between a gasp and a prayer. Katie's jaw tightened. Just barely. Just enough that if you knew what to look for and Dr. Sterling did not know what to look for, you would understand she was holding something back with her teeth. "Doctor, his previous episodes resolved with." Resolved? Sterling's laugh was a weapon he wielded like a scalpel. "Is that what we're calling it now?" He stepped closer to Katie, his voice dropping into the register of a man speaking to someone beneath consideration. "Nurse, nobody thinks she knows better than the attending physician." How quaint. He looked at Eleanor. "Mrs. Riker, I'm going to prescribe a mild sedative that will help your son sleep without triggering confusion. This will happen now, and this will happen because I'm the doctor and this nurse," he gestured dismissively, "is not." Katie felt the moment crystallize. The way a wound stops bleeding feels clean at first, before the infection sets in. The way a jaw breaks feels like pressure before the pain arrives. She looked at Sterling, and for one fraction of a second, something in her face changed. Not trembling. Not fear. Not submission. Something colder. Something that had calculated angles and distances and understood the precise mechanics of how quickly a human body could be taken apart. Then she turned away. And that was the worst part. The turning away. The choice to let it happen. One tear escaped before she could stop it. Just one. She wiped it with the back of her wrist and didn't allow another. Her hand stayed steady as she prepared the midazolam, as she administered it into Riker's feline, as she watched him slip into pharmaceutical sleep while his mother held his hand. "Some wounds don't show on scans, Doctor," Katie said quietly. Her voice remained level. Controlled. That's the problem with invisible injuries. You can't see them to treat them. Sterling's face darkened. His voice became the tone reserved for people he was about to destroy. "That's insubordination. You'll report to my office after your shift, and we'll discuss your future at Sacred Heart." He left. The residents followed. Eleanor looked at Katie with an expression somewhere between gratitude and apology, as if she understood that defending her son had cost something. Katie sat beside Riker's unconscious form and counted his respirations. 16 per minute. Sinus rhythm on the monitor. O2 sat 99%. All the numbers that meant survival. None of the numbers that meant anything else. The morning came grey and cold, the kind of December day where the sky pressed down on the city like a hand. Katie returned for the day shift and stopped at the public board in the staff area. The nurses' station used a physical cork board for administrative notices, timesheets, policy changes, disciplinary actions. It was there, posted in black ink under her name in a font that seemed designed to broadcast shame. K. M. Morrison, insubordination and practicing beyond scope, formal performance review initiated, Dr. L. Sterling, attending physician. The notice had been posted for anyone to see. Day shift. Night shift. Families in the hallway. Other departments rotating through. The kind of humiliation that didn't hide. The kind that announced itself. Katie stared at it for 8 seconds. Then she turned and walked to the break room. The break room at Sacred Heart smelled like stale coffee and plastic containers that had held someone else's lunch 3 days ago. The refrigerator hummed with the steady desperation of an appliance that had seen too much. Katie pulled her lunch from the shelf, chicken and rice she had made Sunday in her apartment, a meal she had eaten alone at her kitchen table, measured out in the precise portions of someone who had learned to consume only what was necessary. The other nurses arrived in rotation. Sarah Lynn came in first, saw Katie, and her expression shifted. She grabbed her protein bar and left. Then Marcus, the male nurse from the night shift, offered a sympathetic nod that somehow felt worse than hostility, and disappeared. By the time the lunch hour reached its center, 5 nurses had cycled through the break room, each of them reading Katie with the same arithmetic, guilty by association, guilt by question mark, guilt by not understanding what Dr. Sterling meant, so better to assume. Katie sat alone at the plastic table in the corner, her chicken and rice cooling on a paper plate, and understood that isolation had a texture. It felt like the air in a room where everyone had agreed not to look at someone simultaneously. But that wasn't the worst part. The worst part was that she had chosen this. 3 years ago, Katie had walked away from the Navy with a discharge marked medical, PTSD, treatment ongoing. She had chosen the anonymity of a civilian hospital. She had chosen not to tell her sister where she had gone or why she had stopped returning calls for 8 months. She had chosen to bury the only part of herself that had ever been certain, the only identity that had weight and meaning, underneath scrubs and a name tag and a silence so complete it had become its own kind of war. She had told herself it was healing. Looking at the empty break room, at the water-stained ceiling tiles, at the cold food on her plate, she wondered if it had been survival or surrender. The door opened. Sterling stood in the threshold with his phone in hand and his expression bearing the satisfaction of a man who had already won before the fight began. Patricia Chen, the external investigator, stood beside him, a woman in her 50s with the precise posture of someone accustomed to finding exactly what she was paid to find. "Nurse Morrison," Sterling said. "I'm sure you're aware that we've initiated a formal review of your clinical practice. Ms. Chen will be conducting interviews and auditing your charts from the past 3 years. I trust you'll be cooperative." Katie set down her fork. "Of course, Doctor. I've also notified your nursing school and requested your disciplinary records," he continued. His voice was cordial now, the tone of a man who could afford to be generous. "Just to ensure we have a complete picture of your professional history." Nothing in Katie's face moved. Not a blink. Not a jaw clench. Not the faintest indication that she understood what he was doing, building a file so thorough that even if she survived this review, the next hospital would find her toxic, too much trouble, too much history, too much question mark. He was building a firewall around her? "That's your prerogative," Katie said quietly. She picked up her plate and stood. "I'll answer any questions Ms. Chen has." She left the break room, and neither Sterling nor Chen made a move to stop her. The corridor stretched ahead like a runway with no destination. Katie moved through it the way she had learned to move, with purpose, without haste, without the flinch response that telegraphed fear. Her hands were steady. Her breathing was controlled. The only thing that gave any indication of the war happening inside her body was something invisible, the fact that her cells were moving faster, her pupils slightly dilated, her nervous system lit like a runway in a combat zone preparing for incoming. She had survived worse than this. She had carried wounded men through streets that were death itself. She had held bodies together that had no business being whole. She had looked into the eyes of people who wanted to kill her and negotiated them into hesitation through sheer force of will. A doctor and an investigator and a written warning should have been nothing. But they were everything, because this time, she was choosing not to fight back. 2 days. That's how long it took Sterling to systematize her erasure. Katie clocked in at 0600 on Wednesday morning, and the reassignment slip was already waiting at the nursing station, her name printed in clinical black ink, her new assignment printed in clinical black ink beneath it, post-op recovery, effective immediately. Not a conversation. Not a request. A decision made in a locked office by people who had already decided her value. The post-op ward sat 3 floors down and on the opposite end of the building from critical care, from the trauma bay where her hands knew every instrument's weight and every patient's fight. It was a cage dressed up in hospital policy, and she understood the message before she even read the memo: keep her away from the ones who matter. The shoes squeaked on linoleum as she walked downstairs, the sound of compliance, the rhythm of a woman who had learned that movement without argument was the only dignity left available to her. Patricia Chen was already set up in the 3rd floor conference room by the time Katie made it to her new floor. The external investigator had arrived at 05 for 5, and the nurses whispered about her like she was a storm system moving through. Patricia Chen had a rolling case the color of stainless steel, files arranged by color-coded tabs, a laptop positioned at precisely the center of the conference table, and the kind of posture that suggested she had spent her career assessing people like they were evidence. Her suit was gray. Her pen was silver. Her eyes were the temperature of a courtroom. Sterling had called her in with the kind of authority that made people move, and now she was unpacking 3 years of Katie's charts like she was defusing a bomb. The interviews began at 0700. One by one, Katie's colleagues were called into that conference room, and one by one, they came back out looking like they had been fingerprinted. Marcus Webb, the trauma nurse who had worked beside Katie for 18 months, couldn't make eye contact at lunch. She seemed professional, he told Patricia Chen, according to the unit secretary who heard him through the partially open door. Not she saved my shift twice or she caught the sepsis everyone else missed. Professional. The word hung in the hallway like anesthesia gas, inert and colorless and suffocating. Denise Rodriguez left the conference room with her jaw locked and her hands shaking. When Katie asked if everything was okay, Denise looked away and murmured something about the weather, about her mother calling, about anything that wasn't the truth. The truth was written on her face. Defending Katie meant naming Sterling as the problem, and Sterling's brother-in-law was on the hospital board, and board members had long memories and short patience for whistleblowers. Sterling moved through the hallways with the walk of a man who had already won. His presence made the air pressure change, not threatening, not overt, just the steady confidence of someone watching his strategy calcify into institutional fact. By Wednesday afternoon, Patricia Chen had already received calls from 3 of Katie's references from nursing school, calls made by Sterling's secretary on his behalf, calls requesting any documentation of performance issues or disciplinary actions. Katie had never had a disciplinary action in her life, which meant nothing, because Sterling knew that people lied to cover themselves, and if her references had any doubts, Patricia Chen would find the cracks. Katie's locker sat at the end of the 1st floor hallway, the one that got overlooked during renovations, the one that somehow still had the original blue paint from 2015. She cleared it on Thursday afternoon during her break, and the security guard, a thin man named Rodriguez with eyes that had seen too much, waited 3 feet away with his hands folded. Her name badge went into a manila envelope. Her spare stethoscope went into a cardboard box. The compression socks she kept for overnight shifts went into the box. The granola bar she had bought on Tuesday and never eaten went into the box. Everything she had built inside these walls, every shift she had survived, every patient she had moved from critical to stable to alive went into a cardboard box that weighed almost nothing. The walk through the hospital took 7 minutes, and every person Katie passed looked at the box in her hands and understood what it meant. The nurses at the station watched. The residents avoided her eyes. The cleaning crew suddenly became very interested in the baseboards. By the time she made it to the parking lot, her hands had stopped shaking, which meant the real damage had already started, that bone-deep calm that comes from understanding that everything you built could fit inside a box that a security guard could carry to the incinerator in under 30 seconds. That evening, Katie drove to the VA hospital on Clearview Avenue, the one that sat 15 minutes from Sacred Heart and 30 years in the past. The waiting room smelled like industrial coffee and resignation. The lights buzzed with the kind of electrical frequency that made your teeth ache after 5 minutes. The walls were beige, the kind of beige that had nothing to do with design and everything to do with anonymity, with rendering a space so neutral it could belong to no one. The intake forms on her lap were 47 pages long. Veterans filled the waiting room like broken statuary. A man in a wheelchair with no legs below the knee scrolled through his phone with the focus of someone trying not to think. A woman in a chair by the window stared at the parking lot with a 1,000-yard stare that meant she was somewhere else, somewhere louder, somewhere with sounds she couldn't stop hearing. An older man sat 3 seats away from anyone else, his leg bouncing in a rhythm that looked like artillery, fast and automatic and impossible to stop. 2 teenage kids in ROTC uniforms tried to look comfortable while their grandfather sat between them, his hands clenching and unclenching like he was still holding a rifle. Katie filled in the boxes. Name: Catherine Morrison. Date of birth: April 17, 1986. Service dates: June 2005 to August 2018. Reason for visit: PTSD, chronic hypervigilance, occupational burnout, the kind of burnout that came from watching people suffer and knowing that your suffering meant nothing in the ecosystem of other people's expectations. The pen clicked. The ink dried. The word sat on paper and became official. She reached inside her jacket collar and pulled out the patch. It was sewn into the lining in stitches so tight and so old that pulling it free meant tearing the fabric, and she had decided long ago that the lining didn't matter, that having the patch was worth destroying the jacket. Faded olive drab, the unit designation still visible if you knew how to read it: Naval Special Warfare Command, Kosovar Detachment, 3 tours to Sangin Valley where the dust got into everything and the sounds of the mountains carried screams. The patch was the size of her thumbnail. The only thing in the world that proved she had ever been anything other than a nurse who folded under pressure and accepted a cardboard box without argument. She stared at it under the flickering light of the VA waiting room, surrounded by men and women who wore their wars the way she wore the patch, hidden, safe, where no one could use it against them. The question started forming in the space where her breath used to be, the kind of question that didn't have an answer but refused to stop asking: had she erased herself to survive, or had she just practiced surrender in the outfit of a martyr? The older man with the bouncing leg suddenly stood up, his chair scraping across the tile floor in a sound like pain made audible. He walked to the window and pressed his forehead against the glass so hard the veins in his temple turned purple. No one moved to help him. Everyone in the room understood that this was his war, and his war was private, and watching it happen in public was the only kindness anyone could offer, the permission to suffer without an audience. Katie tucked the patch back inside the jacket lining, her fingers careful and precise, the way someone handles the last piece of evidence that they had ever been real. Around her, the waiting room held 17 people in various stages of brokenness. Somewhere above her, Dr. Sterling was probably finishing notes, probably reviewing the files Patricia Chen had accumulated, probably adjusting his calendar to make room for the formal hearing where Katie's career would be dismantled with the same precision she had once used to assemble rescue operations. The fluorescent lights buzzed. The older man's forehead stayed pressed against the window. And Katie sat in the beige room with her 47 pages of intake forms, understanding for the first time that the bravest thing she had done in the last 5 years wasn't surviving combat or rebuilding a life or learning to swallow her screams in a hospital full of people who would have used them against her. The bravest thing had been choosing to let herself become small enough to disappear, and now that choice was the only thing standing between her and complete erasure. But that wasn't the worst part. Not yet. Dr. Sterling moved through Sacred Heart Memorial like a man who had already won. His stride carried the confidence of someone who had neutralized a problem, erased a threat, moved a troublesome piece off the board. The folders under his arm, her folders, Katie Morrison's 3 years of charts, felt substantial, final. He had contacts on the hospital board. 3 of them had returned his calls within hours. The nursing school dean had been eager to discuss character concerns once he mentioned legal exposure. Patricia Chen, the external investigator, was already compiling her audit report, and the language would be airtight: insubordination, scope violation, reckless endangerment. By next Friday, Katie Morrison would be unemployable in a 60-mile radius. He passed the nurse's station without glancing at the staff, his reflection fractured across the glass dividers, a man fragmented into pieces but feeling whole. Katie's final shift began at 0600 hours. Sterling had assigned it deliberately. He wanted documentation airtight for the termination, wanted her to close out her charts under his watchful institutional eye, wanted every keystroke and every note to become evidence of her own incompetence. She moved through Sacred Heart like a wraith, like a soldier clearing a building she'd already said goodbye to. The hospital hallway smelled of antiseptic and stale coffee, the fluorescent lights buzzing their mechanical hum like insects trapped in plastic. Her badge felt heavier than usual against her sternum. She knew what was coming. Katie had spent 3 years trying not to be seen, and now invisibility was all that remained. At 0645 hours, she entered the ICU for a final check on Riker. His room was dim, monitors casting blue shadows across the walls. The ventilator wheezed its mechanical rhythm, steady and impersonal. She expected him to be the same as yesterday, eyes closed, pupils unresponsive, trapped somewhere between survival and mercy. She began her assessment without speaking, her hands performing the ritual, checking for flow rates, reading the monitor strips, verifying tube placement. Muscle memory. 5 years of practice condensed into 2 minutes. Then his eyes opened. Not slowly. Not the confused flutter of sedated waking. Riker's eyes opened with sudden, devastating clarity, tracking her movement across the room like a predator tracking prey. His pupils contracted, focused, locked onto her face. For 3 years he had stared through her with the blank gaze of traumatic brain injury, and now he was *present star. The monitors spiked. Heart rate climbed from 62 to 89 in 3 seconds. Katie froze. His gaze held her like hands gripping a cliff edge. Riker's cracked lips moved. His voice was barely a whisper, 3 years of silence breaking, Reaper. The room tilted. Eleanor Riker gasped from the bedside chair where she'd been sleeping. Katie couldn't breathe. Couldn't move. Couldn't process the impossible sound of her call sign spoken by a man who was supposed to be lost to her forever. It's nothing, she managed, her voice coming from somewhere far away. I should, but Riker's hand shot out with surprising strength, his fingers closing around Katie's wrist like a vice. His grip was iron. Desperate. Real. Eleanor was on her feet now, her aged voice trembling. What did he say? What did he call you? The door opened. Melissa Riker stepped into the room. Riker's daughter, arrived overnight from Virginia Beach, carrying her father's features in her face and something else in her bearing, something military. She was Navy. Katie could see it in the way she stood, the way her eyes assessed the room. Melissa looked at Katie's face, at her father's desperate grip on her wrist, at the way Katie's body held itself despite the trembling that started in her fingertips. Melissa's eyes widened. Senior Chief, she whispered. Not a question. Recognition. Are you Senior Chief Morrison? Katie couldn't speak. Her throat had closed. Melissa pulled her phone from her jacket pocket and showed Katie the photo with shaking hands, a younger Katie in desert camis, face streaked with dirt and blood, wearing body armor that caught the desert sun. She was half carrying, half dragging Riker toward an evac chopper, his left leg gone below the knee, and 3 other Marines behind them. 2 of them moving on their own. 1 unconscious. 1 carried. For men out of an ambush that should have killed them all. He's had your call sign tattooed since that day, Melissa said quietly. Her voice was thick. He's talked about Reaper for 10 years. The woman who carried him and 3 others out of Sangin. The woman who held off hostiles while performing field medicine. He's shown me this photo 1,000 times. Eleanor Riker's hands flew to her mouth. Katie's vision blurred. Her hands began to shake, not fear, not vulnerability, but the kind of trembling that comes from carrying weight for so long that setting it down feels like falling. Before she could respond, before she could form words, Sarah Lynn appeared in the doorway. Sarah was the nurse practitioner, Army veteran, 19 years of service before she'd transitioned to civilian nursing. She had passed Katie's desk hundreds of times without a second glance. But now she stopped. Now she looked star. She saw something in Katie's posture, the military bearing that had slipped during 3 years of careful invisibility. She saw the scars on Katie's hands. She saw the way Melissa Riker stood at attention beside her father's bed. Sarah's face went white. She disappeared without speaking. Katie could hear her moving through the hallway, her footsteps increasing in pace. She could hear Sarah's voice, tight with urgency, "I need Chen's personnel file." Katie Morrison's. Right now. There was a pause. Then, "Send it to my phone. I'm calling the captain. I'm calling the Pentagon." The next 40 minutes felt suspended in amber, time moving at the wrong speed. Katie remained at Riker's bedside, her hand now held by his daughter, Melissa's grip steady and knowing. Eleanor sat in the corner, weeping silently, her entire understanding of the young woman she'd hired 3 years ago fragmenting and reforming into something she couldn't yet comprehend. The monitors tracked Riker's vitals, climbing, stabilizing, climbing again as his body struggled to process consciousness after 3 years of chemical sleep. Then the elevator doors opened on the 3rd floor and boots echoed in the stairwell. Heavy boots. Deliberate boots. The kind of boots that had walked across tarmacs and deserts and morgues. A man in fatigues rounded the corner, Commander Hayes, SEAL Team 3, still wearing the desert tan of someone who'd come directly from a briefing. His presence moved the air like a pressure system. Dr. Sterling stepped into his path in the hallway. "I don't know what you think you're doing," Sterling said, "but that nurse is suspended for performing an unauthorized procedure. She's under investigation. I don't care what clearance you think you." Hayes ignored him. Walked past him like Sterling was furniture. The security guard at the end of the hallway, a man named Marcus who'd watched Katie eat lunch alone for 6 weeks, stepped aside without being asked. Hayes reached Riker's ICU room and stepped into the doorway. He took in the scene in one comprehensive glance, the daughter at attention, the mother weeping, Katie Morrison with her hand on the patient's bed, her military bearing visible now like a uniform being removed. He turned to the hallway where 20 staff members had frozen mid-movement. Nurses. Residents. Janitorial staff. All of them suddenly standing at the edges of something they didn't yet understand. Senior Chief Petty Officer Katie Morrison, Hayes said, his voice cutting through the hallway with the precision of a surgical blade. 2 Bronze Stars with Valor. Katie's face drained of color. Sarah Lynn materialized with Katie's personnel file in her hands, her eyes locked on Hayes. Purple Heart, added Lieutenant Morales, who'd arrived 30 seconds behind Hayes. Navy Cross for actions in Sangin, 2018. 17 confirmed combat saves. Sarah Lynn opened the file, her voice trembling, classified unit. Attached to SEAL Team 3. 3 years of service. Medical specialist. Commendations redacted for security purposes. An FBI liaison arrived, Agent Torres, moving with the efficiency of someone accustomed to classified environments. She addressed the hospital administrator directly, her tone leaving no room for negotiation. "Ms. Morrison has been operating under protected identity following testimony against a war crimes syndicate operating in Kandahar province. Her location is classified for her personal safety. Any action taken against her by this institution violates Federal Statute 18 U.S.C. 3521. The hallway had gone absolutely silent. The kind of silence that comes before something breaks. Katie stood motionless, her hands finally still, her eyes fixed on the floor. Hayes finished it. She carried 4 men, including Petty Officer Riker, 3 miles through enemy fire when their convoy was ambushed. She held off hostiles with one hand while performing emergency field medicine with the other. Her call sign was Reaper. Because she brought the dead back to life. Riker squeezed Katie's hand. Eleanor wept. Melissa saluted, a daughter recognizing her father's savior, recognizing the woman who'd kept him alive through 3 years of neurological trauma and institutional disregard. Sterling tried to slip backward, tried to retreat into the stairwell, but Agent Torres stepped into his path. Her smile wasn't kind. "Dr. Sterling," she said quietly, "we need to discuss your disciplinary actions against a protected witness and your communications with her nursing school." The hospital administrator, standing rigid in the corner, his face hardening into something like comprehension, like recognition of a mistake that would cost his hospital its reputation, spoke once. "My office. Now." The boots that had carried Dr. Sterling through his morning with confidence began moving toward the exit, but now they moved at a different pace, toward a different ending. The ICU monitor beeped its steady rhythm, a sound Katie had learned to trust more than human voices. Riker's eyes had been closed for 72 hours, the kind of closed that made mothers pray and doctors nod apologetically at families. Katie had spent her final shift in the cardiac unit doing what she always did, checking vitals, adjusting the ventilator, whispering to a man whose brain had been shattered by blast trauma in Sangin 5 years ago. She didn't expect him to hear her. She didn't expect anything anymore. Then his eyes opened. Not slowly. Not the confused fluttering of someone waking from anesthesia. Riker's eyes opened like a switch turning on, pupils reactive, gaze tracking the ceiling tiles with sudden, devastating clarity. Katie felt her hands pause mid-adjustment on his full line. She had learned not to trust moments like this, the brain playing tricks on the grieving, consciousness flickering like a faulty light before extinguishing again. But then Riker's head turned. His eyes found her face. And his voice, rough from 3 days of intubation, formed a single word with the precision of muscle memory. "Reaper." The 4-needle trembled in Katie's hand. Not from fear. From recognition. That was her call sign. That was the name she had left behind in the Hindu Kush Mountains, buried under 5 years of Norfolk scrubs and deliberate anonymity. Only 17 people had ever heard the word spoken aloud in her presence, and 12 of them were dead. Riker's adult daughter stood from the vinyl chair beside his bed, her hand flying to her mouth. She stared at Katie with sudden, terrified understanding. Eleanor Riker had seen the photograph once, a faded printout from Camp Lejeune that her father kept in a drawer, a young woman in desert camouflage carrying a wounded soldier to a waiting Black Hawk helicopter. Eleanor had asked her father about it 100 times. He had never answered. Until now, staring at Katie with eyes that had finally found home. Eleanor stepped forward. Her voice came out smaller than she'd intended. "Senior Chief." The words hung in the ICU like a defibrillator paddle pressed against still air. Katie felt the entire room shift. 2 nurses at the station turned simultaneously. A resident from the call room paused in the doorway, coffee cup frozen halfway to his lips. The title, Senior Chief Petty Officer, hung there like a confession nobody had asked for. Not nurse. Not staff member. Not the woman Dr. Sterling suspended yesterday for insubordination. Senior Chief. The rank that changed everything about how a person should be treated, should be spoken to, should be regarded when entering a room. Katie's hand stilled. She didn't speak. She simply looked at Eleanor, then at Riker, whose eyes were still locked on hers with a kind of clarity that said his brain had reassembled itself in the seconds it took to recognize a voice he had heard screaming orders in the dark. Sarah Lynn appeared in the doorway like a woman on fire. The Navy veteran nurse practitioner had been working charts at the station when she heard Eleanor's words. She had picked up Katie's personnel file, the one that Dr. Sterling had tried to lock in the investigator's office, and her hands had begun turning pages with increasing velocity. Page 1, Employment Application, Civilian Nurse, 3 years. Page 2, Security Clearance Notation, Department of Defense, Eyes-Only Classification Stamp, Testifying Witness Protection Designation. Sarah's face had gone the color of old concrete. She didn't finish reading. She didn't need to. She was already moving toward the phone, her fingers dialing numbers that most civilians didn't know existed, reaching out to contacts she had promised herself she would never call again. The phone tree activated with the speed of military machinery. 1 call became 2. 2 became 4. Within 90 minutes, the ICU doors swung open and a man in khakis and a SEAL Team 3 embroidered chest insignia strode through like he owned the hospital. Commander Hayes. Not a meeting. Not a briefing. An arrival. He walked to Katie's station with Eleanor and Marcus Wade, the SEAL whose collapsed lung Katie had decompressed 2 days ago, trailing in his wake. Wade had regained full consciousness that morning, had been able to confirm with vivid precision that Katie had performed a needle decompression at the second intercostal space, mid-clavicular line, that the hiss of air escaping had been followed by an immediate O2 saturation climb from 62 to 94 in 12 seconds, that the on-call resident had frozen completely, that Katie had moved like someone whose hands knew exactly what they were doing because those hands had done this before, many times. When the world was burning. Senior Chief Katie Morrison, Commander Hayes said, his voice carrying like a command across the entire unit. Nurses and residents turned. The intercom fell silent. Bronze Star for leadership under fire. Bronze Star for the extraction of 4 casualties from the Sangin ambush. Purple Heart for shrapnel wounds sustained during the same operation. He paused. Each decoration hit like an announcement, each name like a hammer driving a nail through everything Dr. Sterling had built. And a Navy Cross for carrying a wounded officer across 300 meters of open fire to the extraction point, sustaining additional wounds in the process, refusing evacuation until all personnel were secure. The room didn't just go quiet. The room held its breath. Sterling had appeared in the hallway by then, had heard the word Navy Cross, had watched the ICU staff straighten their spines in unison. His face underwent a transformation that took only seconds but felt like watching a building collapse in real time. The certainty drained. The authority evaporated. The confidence that had allowed him to move through Sacred Heart for 3 days with a vendetta turned to something that looked like recognition of catastrophic error. Then the FBI liaison walked in. Agent Torres didn't look like anyone's idea of federal law enforcement. She looked like someone's kind mother wearing a blazer over a shoulder holster. She asked to speak with the hospital administrator privately, and even from the ICU station, Katie could hear the administrator's voice change from questioning to something that resembled shame. The words came across the hallway like wind through a graveyard: protected witness, war crimes testimony, classified identity, retaliation against federal asset, negligence in treatment resulting in life-threatening medical crisis. Dr. Sterling's hands began to shake. Not tremor. Not the small movement of someone nervous. These were the hands of a man watching his entire existence reorganize itself in real time. He had built his authority on certainty, on the assumption that he understood the hierarchy better than anyone in the hospital. He had moved against what he thought was prey, a quiet nurse with trembling hands and a cardboard box of personal items, someone small enough to crush without consequence. He hadn't known. Nobody in the hospital had known. And now the entire structure of power he had relied on was collapsing like a house built on the assumption that the floor was solid when it had always been made of tissue paper. At 1,600 hours, the same security guard who had handed Katie a cardboard box that morning knocked on Dr. Sterling's office door. The doctor had already begun clearing his desk, his framed photographs of himself at medical conferences, his diplomas from Johns Hopkins, his awards for clinical excellence. The security guard waited with another cardboard box, identical to the first, and delivered a single sentence with the tone of someone reading a script written by institutional necessity. "I believe you know the way out, Doctor." Sterling's hands moved to pack his diplomas. Around him, Sacred Heart continued. Nurses whispered at their stations. The ICU monitor continued its steady beeping. Riker's eyes, still open, still alert, still tracking the room with the focus of a man who had been underwater and suddenly learned to breathe again. And Katie, the woman they had tried to erase, the senior chief they had tried to silence, the one whose hands had held the line between life and death so many times that her call sign had become legend in the kind of spaces where legends were forged in fire and blood. Katie stood at the medication cart and checked a medication dose, because the work never stopped, because there were always patients who needed her, because some wounds don't show on scans and some healers don't wear titles that the world respects. The State Medical Board's investigation into Dr. Sterling began immediately. His use of board connections to persecute a subordinate. His failure to recognize a tension pneumothorax in Marcus Wade's case, the medical error that had nearly killed the young SEAL, the very crisis that Katie's hands had solved in seconds. His pattern of documented retaliation against a junior staff member. His draft termination papers, dated before the investigation had even begun, revealing predetermined bias that exposed Sacred Heart to liability that made the hospital's legal team visibly ill. By evening, Sterling was on administrative leave. By the end of the week, his medical license was suspended pending investigation outcome. By month's end, his wife had filed for separation when the first reporters started calling, asking about the prominent physician who had tried to destroy a decorated veteran and failed catastrophically. His daughter stopped answering his texts. His colleagues, the board members who had stood beside him when he was powerful, suddenly couldn't remember him very well. But that wasn't the story that mattered anymore. The story that mattered was Katie sitting in the rose garden 6 months later, autumn sun warm on her shoulders, wearing a civilian dress instead of scrubs for the first time in years. The faded unit patch that she had carried inside her jacket lining, the only proof she carried of who she was and where she had been, finally retired to a shadow box on her living room wall. President Harris stood beside her with the Presidential Citizens Medal in her hands. For extraordinary service to fellow service members, the president said, voice carrying across the garden like a benediction, both in combat and in civilian life, demonstrating the highest ideals of courage and compassion. The medal pressed against Katie's civilian dress, catching the light like a promise finally kept. Riker attended in his wheelchair, his cognitive function slowly returning through rehabilitation and time, and when the president finished, he saluted her with tears streaming down his face, the kind of salute that couldn't be taught, that came only from the deepest place in a warrior's heart when they finally saw someone they thought they'd lost and recognized them not as they had been, but as they truly were. Eleanor and Melissa, Riker's daughter and sister, flanked him wearing custom Reaper t-shirts. Marcus Wade stood at attention in dress blues. Commander Hayes led a contingent of 30 SEALs who had traveled to witness the ceremony. Katie's sister held her hand throughout the entire speech, finally understanding where Katie had disappeared to 5 years ago, finally understanding why the trembling hands and the silence and the careful distance, not weakness, but protection, not shame, but survival. Sacred Heart's new chief medical officer offered Katie a position as trauma coordinator with veteran specialty, effective immediately. She accepted with conditions, mandatory PTSD training for all staff, veteran peer support programs, a voice in protocol development. The hospital agreed to every single one because they had learned an expensive lesson about what happens when you don't listen to the quiet authority of experience, when you mistake competence for weakness, when you fail to understand that some wounds don't show on scans and some healers have already survived far worse than any hospital politics could inflict. Katie returned to Sacred Heart's ICU, not as a nurse to be ordered around, but as a senior chief, as a mentor, as a woman whose hands had learned their skill in fire and whose voice carried weight because everything about her had been tested and found unbreakable. She trained a young resident on grounding techniques for PTSD patients, not sedation, not chemical restraint, but the kind of de-escalation that she had learned in combat and perfected in the dark hours of her own recovery. Somewhere in Richmond, Dr. Sterling found himself teaching CPR at a community college for minimum wage, his expensive suits replaced by a polo shirt with the college logo, his medical license suspended, his certainty stripped away. He would never work in any major hospital again. He would never hold a position of authority anywhere. The thing he had tried to take from Katie, her career, her dignity, her place in the world, he had lost permanently, and the symmetry of that loss haunted him in a way that punishment could never quite capture. But Katie wasn't thinking about Sterling anymore. She was thinking about the young resident she was training, about the SEAL patient whose eyes had finally focused on her face and called her by her true name, about the veterans who came through Sacred Heart broken and left it with the knowledge that at least one person there understood what they had carried, what they had lost, what they were trying to survive. Sometimes the bravest warriors carry stethoscopes, not guns. If this story resonated with you, if you've ever been underestimated by someone who didn't know your true value, subscribe to this channel. Like this video. Comment, have you ever stood against institutional bullying, and what did it cost you? The quiet ones are watching. The quiet ones are always ready. Don't miss what happens when they finally speak.